So thank you guys so much for being here. We have with us Dr. Hagelstein from Nemours Pediatrics and Dr. Neil Rolosa from also from Nemours. So I'm just going to quickly introduce them. Dr. Hagelstein went to Franklin and Marshall and then George Washington University for medical school, finished up her residency at Dartmouth. She has been a practicing pediatrician with both with CHOP, Mainline Health, and now Nemours for the last 10-ish years. She lives in Philadelphia with her two amazing children, and her passions are preventative medicine and mental health. So hi, Dr. H, thank you for being here. Dr. Neil Rolosa is a local from Cherry Hill. He did his undergrad at Georgetown, medical school at Temple, and his general peds residency at Jefferson DuPont. He did his fellowship in pediatric infectious diseases at Children's National Medical Center in DC, where he also worked for the FDA. Then he went on to St. Chris's, and Nemours as well. He's board certified in general peds and pediatric infectious diseases. He's a HIV program director at DuPont, and he's working on COVID-19 associated MISC working group and has been working on the pandemic, including vaccine hesitancy. And he is a principal clinical trial research investigator. So these guys know their stuff. Thank you so much for being here, Dr. Rolosa.
Not a problem. Thank you for having me.
Okay. So you guys looked at the agenda, and if you guys want to get started, just give us the down low on what are the real risks of COVID-19 with children. Go for it.
Sure. Dr. Hagelstein, would you like me to start?
Yeah, how about you get started and I'll follow up? Sounds great.
Sure. So, obviously we've all been living with this for the last year and a half, and things have, from the beginning of the pandemic in early 2020 to where we are now, has changed. And what we knew in the beginning of the pandemic, or what we thought we knew, has changed from where we are today and what we know. And that's especially true for what has happened in the world of pediatrics, and as we think about this pandemic and as it pertains to our children and all. I think in the beginning of the pandemic, we looked at it as mainly a disease that was affecting adults in terms of transmission and infection, and then as it pertained to symptomatic disease and disease severity, including things like hospitalization and death. And I think even in the beginning of the pandemic, that's sort of the way we felt about it. But as we got deeper into this pandemic and it being a novel viral disease and learned more, we understood that we probably underestimated what the involvement and the effect it has had on children in multiple ways. From a purely medical standpoint and infection standpoint, we learned and figured out rather quickly that children do play a part in terms of transmission and infection, not only to each other, but also to adults. While for sure, when we look at it as compared to other age groups, when we're talking about the youngest of our children, yes, thank goodness, they have not been as severely affected in terms of severity of disease, hospitalization, and death. Although, again, as we look through it, that's not an absolute zero. There have been, we have seen at Nemours AI Dupont Hospital for Children, plenty of children who've been symptomatic, plenty of children who've been hospitalized, and unfortunately, we've had deaths related to COVID-19 infection, and that's true throughout the world. And as we are getting deeper in and we're seeing variants, we know that the variants that we are seeing today might be more affecting children than what we initially saw in the pandemic, including we're seeing increases in hospitalizations being reported, especially in those areas where vaccination has been relatively low. and even in parts of the world, increased numbers of death, with a recent article in the New York Times talking about deaths in children in Indonesia. But that being said, still relative to adults, less. We also know in terms of, especially when we look at adolescent and young adults, how big of a part they've played in this pandemic, including being the most in terms of rate of infection and increasing in terms of the proportion of cases that we're seeing for lots of different reasons we can point to. Again, not necessarily in terms of death as compared to those who are older, but definitely has an impact in terms of looking at the pandemic in general. We've also learned a lot in terms of, as we've gone through about transmission of this virus. So in the beginning, where there was some uncertainty of how this virus transmits to from person to person in this, and the mitigation strategies we used tried to reflect that and change as we understood more. Maybe I'll pause because I saw there's a lot of questions about transmission, and I can go a little bit more into detail. But we know the importance of what social distancing and masking has been a part of this. And that includes for our children in terms of how important it has been for us to use mitigation strategies, especially as it pertains to school. And largely the reason why we didn't have huge outbreaks in school, in terms of whether it was virtual learning, hybrid learning, mitigation strategies, again, like masking and social distancing with that in school, that has helped to keep not only our children safe, but also stop the spread of this virus. You know, as we move into now the latter part of where we are, we can see how great the impact vaccination has made on this pandemic, in terms of, especially when we look, and we have to all remember that this vaccine, in terms of when we talked about it in terms of efficacy, was all about, again, the factors like severity of disease, hospitalization, and death. But the sort of other part of this is hopefully helping in terms of transmission and infection. And we see this. Now, I know there's been lots of recent stories about vaccinated people still getting infected, but we knew that was a possibility. And when we look at those stories, the people who are infected or are vaccinated have been relatively well and not necessarily needing hospitalization and die, and proving to the fact that our vaccine is working. And as we now move into a stage where we have been able to vaccinate at least down to 12 years of age, and hopefully soon, less than 12 years of age, we're kind of at a turning point. And we know that getting all of our children vaccinated is going to be not only beneficial to them as individuals, but also for us in terms of ending this pandemic, and for us as a whole, as a community and a country. And while there are side effects, again, that have been a hot topic in the news, it is something that's relatively still rare in terms of the myocarditis, and still relatively mild. And we in the medical community are able to look out for it, monitor for it, do surveillance for it, and intervene in terms of keeping our children safe, even the ones that have had side effects from the vaccine. And hopefully, by doing all these things, and as we move into the school year, and again, doing those layers of things that are helping to protect us, keep us safe, but also hopefully end this pandemic. It's just a new challenge that I think we all need to face together, and hopefully we do that.
Yeah,
Do you have anything to add before?
Yeah, I definitely agree. Just two other things I just wanted to touch base on is that MIS-C numbers. And so when we do think about kids and we think about serious illnesses, that is one of the major things that we think about. Just in June, there were over 4,000 cases with 37 deaths from that. And so we wanted to, that is a highlight, and it is, and it will be interesting with this Delta wave in a month, since it's hitting now. What are we going to see with that? And so that is a large concern. The other thing is the long hauler syndrome. And so these kids who do have prolonged symptoms, and I think there's variability from, what percentage of kids actually have it. And again, it's hard in younger kids because you can't assess those, kids under 12 if they're feeling for headaches and things like that, but could certainly be going on. And that I think is still debatable, but I've seen some things up to 10% in which kids are having the long hauler symptoms, including headaches, fatigue, heart palpitations, and insomnia. So, so those are some of the things that we're seeing on the ground level as well.
Okay, great. That was my question, was side effects, COVID side effects, long hauler, because we keep hearing kids don't die, but a lot of us are wondering, well, what are the other risks?
So I think, and I'm gonna just kind of put this in with the mental health aspect, that I think that if kids can be protected through vaccination, through masks, through other mitigation factors, there's been a lot of kids in and out of school that if we're able to get kids vaccinated and we're able to wear masks, and so there's less likelihood for that transmission, and we can keep that stability of kids in school, which is so important, especially from what we saw last year when kids were in and out, hybrid, virtual, and then they were exposed, and then they were out for 2 weeks and then back in, which unfortunately plays a large part in poor mental health.
Yeah, so while we're talking about mental health, there are people who say COVID has mental health side effects. There are people that say masks have mental health side effects. Let's weigh that.
So, rather than call them side effects, both
a correlation.
COVID itself, both COVID itself and the pandemic itself have had a impact on mental health. That's undeniable, especially when we look at our vulnerable populations and when it breaks down to race and ethnicity in our Black and Brown communities, and it's real. Very real. And it's confounded, though. We can't just point to one thing as saying that has affected it. I think the fear that children have of getting sick, or a family member getting sick, is part of it. The impact of social distancing and virtual schooling and things that have separated them from their social network and interactions with people, and mitigation strategies in terms of it. I would still say, though, when we look at that data, in terms of masking in itself, hasn't been necessarily itself as one factor has an impact on mental health. Looking at it in the large scheme of things, of being a part of the mitigation strategies that we've had to employ to get through this pandemic, you could look at it from that standpoint. But wearing a mask in itself is not necessarily a factor in terms of the effect that has been a part of this pandemic.
Yeah, I agree. I'm not sure I have much to add, except that just from what I see with patients is that masks have not been as much of an issue. Like, kids are okay with wearing masks. I think modeling that behavior is a really good idea. And I think if their friends are doing it, peer pressure can work in your favor. So they're more comfortable with doing it. And I think if it's just an expectation, just like you wash your hands after you use the restroom, or but before you eat lunch, then it just becomes a habit at that point. And I think these kids would much rather be together with their friends wearing masks than being home and not.
Are there health issues that would prevent a child from wearing a mask? And I'm sure there are some, or there's a list. Could you give us some examples?
Yeah, again, to be completely honest, there aren't many in terms of necessarily would necessitate that a child couldn't. There's a developmental aspect of it. And we know that children under the age of 2, it is developmentally a difficult thing for them to be able to consistently wear a mask. But for the most part, even when people have underlying conditions like asthma or other relatively mild to moderate, breathing diseases or chronic diseases that might impact them, they should be able to wear masks. Masks are designed, especially medically grade masks, to be able to breathe normally, and it wouldn't necessarily impede that. And so there aren't really many conditions that would absolutely necessitate that you couldn't wear a mask.
Yeah, I think I've only written one note for one patient to not wear a mask, and that was because of underlying conditions, including autism, biting on the mask, where it was more of a risk and choking factor for him versus actually a pulmonary aspect to that. And so we do this on a case-by-case basis, but it's not common that we write a letter saying not to wear a mask, because if we really look at it, the risk of wearing a mask to the risk of getting COVID, the risk of COVID is so much worse for these kids, especially if they have underlying asthma or underlying immunocompromised or other things going on. And our goal is just to protect kids.
So we did just get a question again around children wearing masks. Is there a substantial self-protective benefit to an individual child wearing a mask at school that does not universally require them? So this is getting into the question of how the masks actually work. It seems likely that transmission would happen in an closed classroom environment for hours, regardless of a cloth mask on only the wearer. So there's a lot of this misunderstanding from people about if you're nervous or you're immunocompromised, then you wear a mask. Don't make everyone else around you wear a mask. Explain to us how that works.
Yeah, so let me try to briefly explain transmission of this virus and then why, if we think back of when we started wearing the mask and what the mask does. So specifically, the COVID virus is spread mostly by what we call droplet transmission. That when we generate a specific size of a droplet from everything from when we cough or sneeze or even sometimes talk, depending on the size of that, it travels a certain depending on the environmental conditions, the airflow, it travels a certain distance, and that is the way we establish the whole 6 feet in terms of social distance, as opposed to other viruses that can be transmitted by airborne transmission, which have the ability, because they are producing smaller particles that can travel through. And so as opposed to needing in most situations a airborne transmission prevention mask like an N95 mask or other types of specific respirator masks for that the mask itself acts as a barrier in terms of preventing it, and it works in 2 ways. When we first instituted more universal masking, it was really about, hey, I could be infected, and I'm going to put on this mask as a barrier to help spread any type of droplets that I'm producing out there to affect others. But we also learned, and we look at it from the standpoint of how we practice in the hospital in terms of general infection prevention, that it also can act as a barrier for if you are exposed to those particles that are covering those areas of which you could take in the virus, including your mouth and your nose, and even in some situations where we have used eye protection or those vulnerable areas of where we could come into contact with those particles. In addition to this is why hand hygiene is important. Although this virus doesn't last so long on surfaces, and good hand hygiene and general hygiene in terms of spreading any type of communicable disease is an important part of thinking about our prevention. And so the mask works in two ways, and it's protective and also helps to protect others if you happen to be infected.
Great. So if masks are not required in schools and a child is high risk, how much can a parent feel better sending them into school with a mask on? I mean, is it okay for them to go? It's a hard call as a parent.
So I look at it this way, and Dr. Hagelstein, you can maybe you have the same or different opinion, right? And again, everyone has their individual ways they have been trying to navigate through this pandemic, right? But if you already are going out into the community and doing things, if you've opened up your bubble per se, right, and interacting, school and within it itself isn't necessarily that much different than going to other places in the community. And our ways of prevention are layered, right? It's not just about one mitigation strategy is better than the other, or it's hard to calculate one being X amount better than the other. And so while I will be completely honest, where we are right now in the pandemic, I am an advocate for us to continue to have masking in school. If there are schools or school districts that don't do it, that if they are employing other mitigation strategies, and for families employing some for their own, including even if it's optional, or for them to have their children to wear a mask, it definitely helps in terms of mitigation, mitigating your risk in terms of being infected. Is anything absolutely 100%? No. But as a parent, as I have children, I have who go to school, anything that I could do if I felt that it was helpful, I would. And I do also, as much as I'm a proponent of masking, I am a proponent of that we can do, and we've proved it, have school and do school safely in person.
So without distance, because now we're not able to have 6 feet of distance, we're down to 3 feet. And in some cases, I'm not sure that 3 feet is going to be an option. So without distance and without masks, what other mitigation strategies could we do?
I think one is vaccinations.
Well, sure. I mean, before in our kids who are not able to be vaccinated. Is there anything else that we can do to protect our kids?
Being frank, not so much. Yeah. I think that, I mean, it's about, so if you're trying to have that distancing, that it's about then having to think about what we did before in terms of limiting the amount of students that could be there at a given time, and giving different schedules and doing things like that, trying to, if there are opportunities to work outside and do things like that, that would be it. But I don't think there is some sort of magic bullet strategy that if you aren't going to employ any mitigation strategies, of the ones that we have shown to be proven from that you're really you're not really putting our children or in a situation where you are decreasing the risk of getting infected.
And I think part of it is like you're looking at the herd immunity. Like if you're sending your kid who is at risk, let's say immunocompromised, and you're sending your child, are you feeling comfortable sending your child to a school where they're not wearing masks or having any other mitigation factors or strategies, I think that you're going to feel pretty uncomfortable just because of the, is how the risk of getting it is probably higher than if you do use these mitigation factor or strategies. And so I think with looking at that, I think the other aspect is that, looking as a community and looking at as a school, again, we want to protect ourselves and we want to protect other people and other people who may not be able to be vaccinated or other people who may not be able to wear masks. Like, again, it's hard to think about that we're like, 18 months into this, but again, we're looking at this as a community. How can we work together to protect ourselves and other people? And I think the more mitigation factors that you can put into place, the easier it will be. I think that if we don't have mitigation factors, including masking and social distancing, then you're getting into the cohorting, hybrid, virtual school, and then we're going down a whole another pathway that's leading to a whole series of other things. And that has been like the past year and a half of our office visits is the mental health aspect. And I think that, that's not helping as well. And so I think we have to looking at it from that perspective.
So we just got a question, and it's a good one about testing. Let's talk about testing. Antigen testing, pooled PCR testing, surveillance testing. How can are you a proponent? How can we utilize this? Does it help?
Yeah. So I think there's a couple of different ways to look at this. We knew from the beginning of the pandemic, availability of testing and having testing, again, was not only important for making a diagnosis of someone who's sick, but also a prevention strategy, and it's important. But that being said, we have to understand the tests that we're using. We have to also understand that these tests weren't necessarily designed. This technology wasn't necessarily designed to do sort of what we were trying to ask it to do in terms of surveillance and doing all that, because they have their limitations. Whether we're talking about antigen testing, whether we're talking about antibody testing, or whether we're talking about PCR testing. And so when we're thinking about how we're using it, we have to think about those limitations and how they apply to the situation that we're talking about. Put availability, put cost all aside, and say, well, how would that work? How does that look? We know that antigen testing can be flawed in terms of both having false positive and false negative, although it can be readily available. And so we have to keep that in mind if we are choosing to do testing as a way of trying to weed people out or try to use it as a mitigation strategy in terms of, okay, it might be available, but is it really giving us the information and giving us that the security of thinking that is a reliable method in doing it? I would say that maybe, but again, it all depends on the situation. And I think I would personally rather rely on the other mitigation strategies than to rely on antigen testing as doing it. So what about things like antibody testing? Well, antibody testing, does not isn't a quick enough turnaround and does not work in terms of thinking about it from someone who's acutely infected and therefore also more likely to be able to transmit infection. And so it's in real time, not necessarily helpful for us to think about it as a mitigation strategy to decide whether or not someone can go to school that day or what have you. We also know that once you are infected, you could still have antibody, but that doesn't necessarily is a reflection of that you are still able to transmit infection, transmit the virus and cause infection. And then lastly, PCR technology, which is very highly sensitive, highly specific in terms of being able to make a diagnosis, not as readily available. But again, just because you have a positive test doesn't necessarily speak to how infective you are in terms of your how transmittable you are. And again, all of these tests have a window period of where, even though you might be infected and able to transmit, that may not be 100% in terms of in real time being able to detect that. So could it work in certain situations in terms of helping? Yes. Would it be my only mitigation strategy? No.
How about pooled PCR testing?
The same thing in terms of it has its limitations and being able to do that. When we talk about pooled, it really is more of sort of a resource strategy in terms of being able to do more tests and maybe save some resources one way or another, but not necessarily that it gives you more accurate or real-time information to be able to use it as any better than any of the other things that we were talking about in terms of mitigation strategy.
Can you tell parents what high risk is? What conditions count as high risk? Can you give us a list so that we can be more informed for our own kids?
Yeah, and this is actually listed on the CDC website, and so this can be easy access, but asthma is actually on there. Immunocompromised, kids less than 1 year of age, kids who have congenital heart conditions, some children who have genetic conditions, underlying neurologic and metabolic conditions as well, obesity, and children who have diabetes and sickle cell. Those are the ones that are listed on the CDC. Again, those can always be run past your other things can be run past your pediatrician, especially for more things that are more specific.
What do you guys say to people who say masks are not that effective? There have been some people saying that, the ones that I buy at Old Navy, it say on them, the label says, will not protect you against a virus. What do those labels mean to you?
Yeah, I can't speak to specifically what they're talking about. I'm not familiar with a box saying that or what have you, but I mean, with all due respect, part of the reason why we're not probably deeper into this pandemic in terms of morbidity and mortality is for the decision we made in terms of earlier on in the pandemic of instituting masking. No doubt for me in my mind, and it's not a belief, it's based on data in terms of what we see. And if we just think about it again, I tried to my best to kind of explain how transmission of this virus works. Knowing the science of how this virus transmits on a one-to-one kind of basis or a person-to-person basis, it works. It works for other diseases. And here's probably one of the biggest ways you can do this. For all the cold viruses that we would normally see during the winter time, everything from RSV, influenza, and other viruses, we weren't seeing them. In a normal season in our hospital for RSV, we would have a full hospital with many of the kids having, especially the little ones, being affected by RSV. For a good part of the wintertime, we had 0 cases of RSV. And now, when things have opened up, where masking has been, the mandate has been taken down in most situations, in most places, we are seeing out of season rises in those viruses that we wouldn't normally see, and hospitalizations related to them, including RSV and other cold viruses that we wouldn't expect in the middle of the summer to see. So masks work.
And I joke with my patients, I say, you just can't have a cold in the middle of a pandemic. You need to be tested. You're coming into the office, you're being tested, you're being, your child's out of daycare at that point, you're out of work at that point. And so it's like any protection that we can have, the better. And I think, just seeing around the country, like these comorbid, in which the sense a child has RSV and COVID, so those are ending up in the hospital as well. So if you have a double whammy, especially if you have an underlying condition like asthma, it's possible you could be ending up in the hospital.
It's a great question about masks again, especially with Delta. Is there a specific type of mask that we should be looking at? Should kids be wearing K95? Speak to any mask being better than
No. Yeah. No, N95s, like I said earlier, the majority of the time when we're talking about how this virus is transmitted, and we're talking about it specifically by way of that we call droplet transmission. And so a respirator mask like an N95 in most of these daily situations and otherwise ordinary situations, no, you don't need that. I think earlier in the pandemic, there was, based on some studies, some confusion or misinterpretation of that studies in terms of this is better than that or what have you. I think for the most part, most of the masks, cloth masks, whether they're truly or depending on where you're getting them from medically graded masks that are available. Most of those things are going to be fine in terms of what we're hoping to do with this, in terms of blocking that the droplets that you're producing or that you could come in contact with. So I don't necessarily think that there is one masks are better than others. I think there is a preference, though, in healthcare settings that we use either, again, cloth masks or medically grade masks, and tend to shy away from things like the gaiters or bandanas or anything like that. And that's partly because of the fit, right? You do want to make sure that your mask fits right, that it's not too tight as to, again, maybe impede normal breathing, but it needs to fit right in terms of around your mouth and around your nose to help prevent the spread of those droplets.
Great. A couple more questions on masks and immune systems. Very interesting question. So I guess people are thinking that if you do wear masks to the point where you are no longer getting colds, are we going to somehow impede our immune system from being able to, fight these things off?
So I'm sorry, Dr.
No, I think you probably have more data than I do, but I think this pandemic will hopefully not last forever. And I think that at some point masks are going to be coming off. And so we are going to be exposed to different viruses. And so I think down the line, we are going to be exposed, but I don't think it should affect our immune system. There's many other factors that can affect the immune system, but I think, wearing masks is not one of them.
So for full disclosure, I wear many hats as an infectious disease doctor. One of the large part of things I've done throughout my career is taking care of patients with immunodeficiencies, including HIV, but also ones that are genetic or what we call a primary immunodeficiency. While exposure to certain viruses, certain types of infection can help our immune system, that's not the only way our immune system works. There's many parts to our immune system, and merely wearing a mask and not necessarily being exposed to certain infections during a period of time doesn't do anything necessarily in the overall picture of how intricate our immune system works that would make us have a quote unquote weaker immune system later on down the line.
Thank you. So we've been talking about some of our numbers for the summer. They've been pretty good, COVID-wise. So people are saying, you know, if our kids are going to parties and camps without masks on, why would we all of a sudden start wearing them again?
Go ahead.
Yeah, no, please go ahead.
So while our numbers are good right now, right, like we've seen at many time points in the pandemic, it's sort of our numbers, especially when we're talking about big numbers, lag behind what we're seeing. I'm not necessarily trying to predict the future in terms of it, but it wouldn't surprise me that we are going to see bigger numbers as we get towards the end of the summer and into the fall. I mean, we already know that reports out of children's hospitals in areas across the country, and it falls in line with those with lesser vaccine rates, are going up, hospitalization, infection rates. And so while it might seem like things, I mean, and numbers were better in the beginning of the summer, I don't think we could broadly think that that is going to necessarily hold true as we go into the later summer and into the fall. And again, especially as we have variants of this virus that are creeping up, that seem to be more transmissible, seem to be cause more severity of disease, that the likelihood of numbers, if we don't, if we continue not to do some of the things that we're suggesting to do, will go up.
Yeah, I think in the past 2 weeks, I've been following the numbers in PA, and it's increased. You know, the positivity rate has increased by 1.5% to 2%, and that's just in the past 2 weeks. And so I think as we're seeing the Delta variant come into the community, we're definitely seeing those rates come up. I think the other aspect to this is that there's a lot of thought that this is a winter disease as well. So as people are going inside, that it's going to be possibly a higher positivity rate as well. I mean, I think a lot of these summer camps and get-togethers are actually outside, which decreases the risk as well. And so although we have been lucky with a lower positivity rate and with being outside, meeting up, once we get inside and it being a winter disease, I think we're going to see, as Dr. Rosa said, increasing.
But a couple of great questions in here. So as our adult population and over 12 get vaccinated, do we expect that children, our percentage of cases will happen more in our under 12 population? Will our vaccination rate change the dynamics of the spread? I've been hearing a lot about this is now going to become a pandemic of the unvaccinated.
So I think that's, it's somewhat true is what we're saying, right? And we also know somewhat from extrapolating data and looking at it in terms of, yeah, the less people we have vaccinated, and sort of there is a statistical and theoretical breaking point of where if we don't get enough people vaccinated, the idea of that, I think a lot of people are somewhat banking on that there's going to be some sort of herd immunity, that's going to be enough. But we're not reaching those numbers when we're talking about vaccinating. And again, we've been talking about vaccination, people have been vaccinating, but there is a huge part of our country, right now, 12 and under, that are not. And again, people want to quibble about the severity of disease as it pertains to children. What's not, which is, in my mind, not debatable, is that children add to the spread of this disease. So we need to think about it. Yeah, as Dr. Hagelstein pointed out, there is a not only personal, importance of vaccination, but also greater good.
Yeah, I know that a lot of people are thinking because children don't show symptoms, they also don't spread it. Can we talk about the myth of that? I'm assuming it's a myth. I mean, children do spread it.
Correct.
Yeah, they might not spread it in certain situations as much as an adult, but they do. I mean, again, for all the what we've been talking about, right? And I'm sure there's lots of people on this call who have had children or friends or what have you, who their children got affected when maybe at some point in the pandemic, they were around other children who were infected, right? And so you don't need necessarily huge scientific studies or what have you. It's there, it happens. And you're right, we might underestimate it a little bit because children may not be as sick, or they have minimal to none symptoms at all, or we are not really as aware or in terms of picking up on that on a child if they have symptoms. So yeah, children are part of the story in terms of transmission of this virus.
I think it's a mental shift. I think in the beginning of the pandemic, it was like, we have to make sure that kids are masked and safe so they don't get grandma sick. But now we have to have that mental shift of like, hopefully grandma's vaccinated. And now we have to, as a community, keep our kids safe. So it's not just older people. Now it's a shift in our mindset. And although, and I think that as kids are going back to school, we're going to see the rates increase, and we're really going to see how important it is to really protect these kids.
I have another question about a child who was hospitalized with RSV as an infant. Are they more likely to have a more severe reaction to COVID as a toddler?
No, there's nothing that necessarily indicates, that having a preceding illness, like a viral illness from something like RSV, would put you at greater risk. I mean, if there's, for that particular person, if there's no other underlying problems like the ones that Dr. Hagelstein had kind of pointed out, then it isn't. Having had RSV, before wouldn't necessarily put you at greater risk, nor would it also put you in a situation where that could be protective.
Let's talk about our teachers. So I'm not sure if you realize this, most of them have the J&J vaccine. So how protected are they if our kids do not wear masks, especially against Delta, knowing that the J&J vaccine is slightly less effective against Delta?
So a little bit kind of answered that question in itself. Yes, we know that the Johnson & Johnson vaccine, and at least in the studies that we have, its overall efficacy. And again, what we're talking about, again, is when we are talking about the efficacy numbers of these vaccines, it's about severity of disease, hospitalization, death. That it is, as compared to the mRNA vaccines, the Moderna and the Pfizer vaccine, maybe be less in terms of its efficacy, and now even with the Delta variant may be. But it's still protective. It's still better than nothing, and way better than nothing, I should say. And as it stands now, and it's ongoing and it's continuing to be investigated, the current recommendation is not for people who have had the J&J vaccine to get a booster or get more doses of a different type of vaccine or another J&J. I think that continues to be discussed, continues to be thought about, but we're not necessarily seeing signals that would say absolutely, and that's what we need to do right now.
And again, I kind of want to push back. I want to kind of look at the bigger picture of just like we're looking at this as a community. So, you know, why did the teachers get the J&J vaccine? To protect themselves and protect the kids. And so if we're looking at the kids, again, we want to protect our teachers as well. So, you know, and I'm so happy that they got the vaccine and they were one of the first to get it under the J&J ones. But I think just looking at it from a community aspect, we want to protect each other. And so I think kids wearing masks protect themselves and also the teachers are really key.
Yeah, absolutely. Here's another one about how important is it for universal masking versus just masking unvaccinated individuals with regard to actually decreasing transmission rates?
So again, if you aren't familiar, and again, I discussed this with a little bit of hesitation because it's important to, again, look at the whole picture, but you know, what recently in this past week was highlighted in a study of an outbreak. Again, I'm using the word outbreak sort of in quotes, but in Provincetown, Massachusetts, where we had a significant number of people who were infected in a cluster that were vaccinated. And again, we knew from the beginning, and this is how many vaccines, really most vaccines sort of work, is that we're not really talking about, when we talk about its effectiveness, how great it is in terms of stopping transmission and infection. It's about mitigation of disease or attenuation of disease or symptoms. And so people can still get infected and transmit the virus, even if they're vaccinated. The likelihood of them getting severely sick, being hospitalized, death, greatly decreased. And so while I fully understand, because here's the thing about this pandemic, we're all living this together, and I get it. I'm not in a bubble, and it has been difficult for me on a personal basis, just like all of you, in terms of the social distancing and the masking. Where we are right now, in terms of infection and vaccination rates and worrying about variants, that even though it feels like health officials and people maybe in the medical community are kind of wishy-washy and waffling or going back and forth, and it's difficult to understand or difficult to put trust in what people are saying. I think right now where we are, we're not at a point where that the mask can go, and that in certain situations, although it is somewhat of a step back, that we need to be masking, and that includes even outside of school in certain situations, as the CDC has said last week, that we're going to need to wear masks indoors.
I think we see that as the rates are going up, that it's like now we need to put some of these mitigation strategies back into place, and that is masks. We've seen that it's effective, and that it's something that we can do, and that we should do it. So again, that we're decreasing, so that rate of infection plateaus and starts going back down again as much as we can.
And going back to those types of masks, if they are not required in schools, and so children are choosing whether or not they want to wear a mask, should they choose a higher filtration mask like a N95 or a double masking? Would you recommend that?
Definitely wouldn't recommend an N95, especially if there's already concern in terms of if you've ever worn and maybe some of you have, if you've ever worn an N95 for an extended period of time, if it's fit correctly, and that's one of the things that probably people miss, is that just buying an N95 and putting it on is probably, you're not assuring yourself. When we get in the hospital, when we have to use N95s for other things like tuberculosis or whatever, we have to go through and make sure that the mask fits properly in order for it to be used correctly. And in most situations, practically every situation that we're talking about in everyday life, that's not when we're worrying about this virus being airborne, spread by airborne transmission, and we don't need N95 masks in that situation. You know, prior to more vaccination, you know, again, in certain situations, double masking was recommended. That hasn't kind of come back. And again, I think it's in certain situations that you might want to consider. But really, in terms of how you do that, the data that kind of supported that was use of a medically graded mask with a cloth mask on top of it. So just putting on two masks or two medically grade masks or two doesn't necessarily is not how, when we talked about it, it was intended. I think for the most part, if the mask that the cloth mask that I think the majority of people have been using, as long as it fits well, right, and covers your nose and mouth, you're good.
I keep seeing people saying that things keep changing, recommendations keep changing, the medical community keeps changing. Tell us a little bit about the process of changing guidelines and how we can feel confident in our medical professionals.
I mean, Dr. Relosa is on the back end of things, but just as like a front line here with and so I think we just have to remember that it's evolving. The wheel wasn't invented overnight. It took time, and it took multiple and it took studying, and it took research, and it took like what worked. And so I think that with the knowledge that, you know, there are people who have everybody's best interests at heart and trying to figure this out. And so, yes, things keep changing, but it's really looking at the data behind it. It's really doing studies, and it's just, and honestly, I'm telling parents to do their own research with their own, giving them different podcasts or different websites to look at, especially the CDC or kidshealth.org. And so doing their own research is fair, and then coming back and asking questions. And I think that's the appropriate thing to do, especially if there is confusion about a particular recommendation that came and then went and then came again. And I think that's a fair discussion to have about that.
Yeah. So I will say, although I'm on the back end of things, I'm also on the front end of things. I throughout the pandemic have been going into work every day. I've taken care of COVID positive patients, been see patients. And so one of the things that when we talked about it, when even within the medical community, within our institution, there has been doubt or uncertainty, especially when we have had to change. And I don't know if this provides anything that I have been a part of in terms of recommended or is stuff that I would do for myself in terms of personal protective equipment. When I have, me and my colleagues who've been part of it, it's what we wear when we go see COVID positive patients and what we do when we do that. And it's not so much when we switch, as Dr. Hagelstein was sort of alluding to, it's because we made some sort of mistake or made some sort of big miscalculation. It's because this is, again, such a novel disease, and we are making the recommendations, making the things that we're doing based on the data that we're gathering. And sometimes that data is gathered and obtained slower than we like. And sometimes we see trends that are different than necessarily are expected. And there's so many things that can confound what we see, right? Because okay, now we're doing that and we're doing this, and then it changes. And part of it is that we need to be flexible. We need to be adaptable to the changes that we see, and hence why things have okay, we said this, but now we have to go back to this, or we have to do that, and that it is something that is forever in flux, and that we just need to be nimble to be able to respond to it.
Do you see any evidence of the Delta variant being more virulent with young children?
Yes. Okay, go ahead. I'm sorry.
No, it's fine. I was actually curious myself because I've seen that it's in question, but I saw Dr. Ralosa has more.
I think we're still gathering information, right? But if we are looking at probably, the majority of infections that we're seeing in the United States are Delta variant, right? And when we talk about Delta variant, I should also say that there are variants within the Delta variant, right? This is the nature of all viruses, that they mutate, and it's part of their own evolution, and we see and things evolve and all that. But if we look that the majority of what we're seeing in terms of infection overall in the United States is due to Delta variant, and we're seeing that we are trending towards having more infection in children and young people, specifically those who are unvaccinated or in high end vaccinations. And we're having reports from hospitals, pediatric hospitals, that they are seeing increases numbers in terms of slow increase in terms of infections and hospitalizations. It's good to me. It goes to speak to, yes, the variants, including Delta variants that we're seeing, are different and maybe more virulent, can cause more severe disease, are more highly transmittable than the beginning viruses that we saw at the beginning of the pandemic.
Okay, so if you were going to give our policymakers, school board members and decision makers one piece of advice to keep our children safe and open, do you have?
I have a couple pieces of advice, of course, but I would say the one piece of advice is to make sure that you look at the community and what is best for the community, including kids who can be vaccinated, who cannot be vaccinated, kids who can be masked and unmasked, and the greater community as well, to keep kids safe. I think a great resource is the AAP guidelines for going back into school with wearing the mask, and not only, but other mitigation factors as well. And so I think really following those guidelines will really help protect kids in multiple different fashions against COVID, but also getting kids back into school. And so we can continue to have somewhat of a normal school year and less disruption of life.
Yeah, I think that might be the toughest question that you've asked us tonight, in terms of, hard to say one thing. I think, as we've kind of illustrated throughout this, that to fight this war against this pandemic, it's multifactorial. And I agree everything what Dr. Hagelson said, especially in terms of arming yourselves with information, but making sure you're getting it from good resources, and why, for me, like doing a town hall like this is important, because obviously it's part of my job, but just like everyone else, my hope is that we end this soon. And if I can be a resource and help in terms of giving people with the right information, I'm happy to do so, and we'll do it as many times as you need. And I know I speak for my colleagues who do the same. So really, in terms of if there's one thing, is that everyone makes a concerted effort to arm themselves with not only with information, but the right information.
Sorry, have some noise over here. So yeah, we just have one last question for some good resources. attending, for anyone who's attending via email. I will absolutely follow up with you guys, maybe so that you can share some credible sources for our decision makers. I'm not going to keep you too much longer because we could definitely go all night, but I guess I love that you are willing to keep talking to us. I know that our policymakers are going to keep having these questions and these arguments over and over again. If I would just like to say to them on the line, if you guys are willing to meet up with them again, we would so appreciate it.
Absolutely.
As I said before, we're going to share this recording on social media, and you know, anyone who wants to comment on YouTube who might have questions, I will absolutely pass them along to you guys, so that we can keep this dialogue open, because you know, just until we can all be protected and the pandemic can be really over.
We have to get back to the engineers so they can send us a revised draft.
Anyone else?
Give us the revised draft.
Last call.
Thank you for having me. I appreciate it. And like I said, I'm sincere in the fact that happy to do it again, or if I can't, offer my colleagues to do the same.
Thank you. This is a great opportunity.
Wonderful. Thank you guys so much. We really appreciate it. Have a great night. Bye.